Hi guys, my name is Connor Paxton. I am a student at Arizona State University and I am training to be a community health facilitator with Heal International, which is a nonprofit that does some pretty incredible work here in Arizona and also in Tanzania. So thank you so much for being here with me today. I'm super excited to be here. And also congratulations. I know this is such an exhilarating, exciting time in your life. So thank you so much for being here, taking the time out of your days to be here with me and allowing me to speak to you and just share this experience with you guys. I know this is a really awesome time for you, so I'm really glad to be here. That being said, we're going to be talking about HIV transmission today and specifically mother-to-child transmission. And it's going to be a quick conversation, about 5 to 7 minutes. If you need to leave at any time, you're more than welcome to. If you have any questions, please feel free to ask them. We'll also have time for questions at the end as well. But yeah, as newly expecting parents, I know that you guys are committed to the health and happiness of your child. So I'm here today to give you guys the tools to not only protect your child, but to also to protect yourselves and your loved ones. So thank you for giving me this opportunity. And due to the sensitive nature of this conversation, there might be information shared that individuals would like to keep confidential. So I just ask that anything that is shared today just stays in the room. And if I could just get a quick nonverbal agreement of everyone that's okay with that. Perfect, thank you guys. So there's no cure anywhere in the world for HIV, but there is incredible treatment that is available. The only way to get access to this treatment, however, is just to get tested. So we encourage you to get tested, know your status, that way you can protect yourself and your loved ones from HIV. And there are 3 times in the early development of a child at which the child is at risk for contracting HIV from an HIV positive mother. The most common of those times is during birth. So during birth, there is an enormous amount of vaginal secretions and blood being released from the mother. And as the baby's passing through the birthing canal, it's a very stressful situation that can cause micro tears on the baby's skin and allow access of the virus through these fluids, through the open wound in the baby's skin, and that way the baby can contract HIV. The good thing to know, however, is that this is completely preventable if the mother starts taking anti-HIV drugs. And the only way to get access to these is to get tested. So get tested, know your status, that way you can protect yourself and your baby from HIV. The second most common or other common time is through breastfeeding. Breast milk is one of the fluids from an HIV positive person that would carry HIV. And during teething, the baby has open wounds in the mouth through the teeth that are coming through the gums, and this can allow access of HIV into the body through these open wounds from the breast milk coming into contact with the teething marks in the baby's mouth. So that's another way that the baby could contract HIV. And again, this is completely preventable if the mother is taking anti-HIV drugs. Another option is just to breastfeed up until the baby starts teething, or also use a wet nurse. These are all viable ways to prevent the contraction of HIV of the baby. And the third way, which is really rare, it can happen in only very extreme cases, is in the womb. So the placenta acts as this protective covering over the child, and HIV cannot actually pass through this membrane, except in extreme cases in which there is trauma or malnutrition, which causes perforation in the membrane of the placenta and allow HIV access into the placenta and in contact with the fetus. And this is another way that babies can contract HIV from an HIV positive mother. But again, it's very, very rare, and it can be limited as long as the mother is taking anti-HIV drugs. Only way to get access to this is to get tested, know your status, that way you can protect yourselves and your loved ones. So again, just to recap, it's just 3 times that the baby is at risk: during birth, breastfeeding, and in the womb, which again, I want to stress is very, very rare. Only in very extreme cases does this happen. So yeah, thank you so much for giving me the opportunity to run through this with you guys. I hope that I provided some sort of foundation for you guys to learn something today. And also just encourage you guys to, again, get tested, know your status. That way you can protect yourself, your baby, and your loved ones from HIV. And thank you so much again for being here with me today.